Worldwide, there are approximately 16 million people who inject drugs, and of these, 3 million are estimated to be HIV positive. In Canada alone, there are 89,950 people who inject drugs, and of those, 14% are HIV positive. These numbers are alarming, and it's the main reason that needle-sharing programs were created. In 1987, the first needle-sharing program was created in Toronto, Ontario. Since then, over 30 needle-sharing programs are operating in Canada today. What is a needle-sharing program, you ask? A needle-sharing program is a fixed location or mobile program that offers persons who inject drugs free needles in exchange for their used ones. The nurses in these programs offer mobile services, so those who don't have access to transportation may be able to use this program. Since the creating of needle-sharing programs, there is strong evidence that the effectiveness of these programs demonstrate a steady reduction in unsafe injection practices and risky behaviors. In fact, it is estimated that unsafe injection practices have decreased by 60%.
Needle-sharing programs warrant political action to maintain increased services. The current political stance in Ontario is to reduce or even stop needle-sharing programs. If these programs close, we are increasing the risk of increasing the burden on our healthcare system financially and physically. It is estimated that in Canada, the average cost of treatment is $1.3 million per person infected with HIV. It is also known that people who inject drugs frequently visit the emergency departments for treatment and recurring hospitalizations, thus furthering our financial burden and also adding to wait times. The most important reason needle-sharing programs need political action is due to the political stance of Ontario's progressive conservative leader, Doug Ford. It has been reported that Ford is against safe injection sites used in needle-sharing programs. Ford is leaning towards a rehabilitative approach rather than a harm reduction approach. Evidence has shown time and time again that needle-sharing programs work in reducing the spread of infection. Evidence has also shown that rehabilitative approaches don't work. Needle-sharing practices actually tend to rise with the closure of needle-sharing programs. RNAO has issued an action alert urging Doug Ford and Health Minister Elliott to scale up approval and funding for safe injection sites and overdose prevention services. The deadline is rapidly approaching and we must take action.
It's the duty of nurses in the community to be able to recognize potential health threats as well as working to minimize certain barriers affecting the public. This includes physical barriers for people who are injecting drugs, such as distances from the needle sharing program, homelessness, and those living in rural communities may not have the transportation to access the needle sharing program. As nurses, we can advocate for increasing mobile services in addition to the fixed location to ensure greater access to care. A social political barrier to care involves certain groups such as women and minorities. Women may fear the social stigma of seeking care, and those with children may fear losing their children after their addictions are known. Minorities may fear seeking help as it goes against certain beliefs and cultural practices. It has been known that many racial and ethnic groups experience the gravest of health risks, such as HIV. Thus, it is particularly important for these groups to have access to and are encouraged in these programs. Nurses can facilitate women and minority groups to access the needle sharing program by providing accurate, easily understood information and ensuring they understand that their information given is strictly confidential.
It is crucial that as nurses we identify individuals who need care, particularly those affected by needle sharing programs who inject drugs. It has been found that injection use often begins in late adolescence and typically in rural areas. Of the youth in Canada, 36% have been found to have injected drugs at one point in their lifetime, and overall, females tend to inject drugs 3 times more often than males. These individuals who are injecting drugs need to be identified at an earlier age and provided with information and access to a needle-sharing program so that these risky and potentially life-threatening behaviors end. Due to the alarming numbers of drug injections, community nurses need to act fast. By advertising and promoting these programs, we can help reduce these individuals' risk of contracting blood-borne viruses.
Safe injection facilities are legally sanctioned facilities that allow people to consume pre-obtained drugs under the supervision of trained staff and are designed to reduce the health issues often associated with public drug consumption. Facility staff members do not directly assist in consumption or handle any drugs brought in by clients, but are present to provide sterile injection supplies, answer questions on safe injection practices, administer first aid if needed, and monitor for overdose. Staff also offer referrals to drug treatment, medical treatment, and other social support programs. The first safe injection facility, called Insight, was opened in 2003 in British Columbia. In 2017, the site recorded 175,464 visits by 7,301 different users. This is an average of 415 visits per day. Since the site opened, approximately 2,395 overdoses have occurred with no fatalities due to intervention by staff. The fatal overdose rate has decreased by 35% after opening, and there has been a large decrease in public drug use. Based on the services provided by staff, Insight users are 30% more likely to engage in addiction treatment than non-Insight users.